Hi, we are Group 5, 9 a.m. BST, and today my colleagues and I will be discussing our 5 evidence-based recommendations on how we believe the WHO can prepare for the next viral pandemic through improving the uptake of vaccines. I would like to firstly highlight that the foundation to any successful response to a viral pandemic and uptake of vaccination is strengthening healthcare systems and preparedness, which is our first recommendation. The first line of defense against any future pandemic is building resilient national health systems, which can withstand health shocks while still maintaining routine functions and providing critical diagnostics and vaccination. Therefore, the following can be achieved through the adoption of a health systems resilience framework, which include several key factors, such as awareness of system strengths and weaknesses, equity, ensuring universal healthcare coverage, and access to emerging medical interventions. Adaptivity, where healthcare systems encourage flexible responses and act on evidence-based feedback. And of course, sustainability, building self-regulating and scientifically grounded health systems.
Furthermore, it is vital to tackle existing inequities through inclusive policies. Regardless of gender, socioeconomic status, and ethnicity, etc., everyone has equal rights to access healthcare services. It is high time that we ensure even the disadvantaged have their representation in policymaking, which helps tailor policies that specifically cater for their needs. Meanwhile, it is encouraged to expand health insurance coverage for particular groups through diverse strategies. For instance, modifying eligibility criteria, making a premium affordable, and simplifying enrollment procedures. All in all, strengthening the healthcare system truly is the pillar of any emergency coping mechanisms.
Our second recommendation is the adoption of a revised fair allocation framework through the COVAX facility to enable equitable distribution of vaccines. Incentives for high-income countries to participate in the COVAX facility are currently inadequate, therefore its mobilization has been slow and insufficient. Firstly, if the multilateral COVAX system is to be used in future pandemics, external bilateral deals must be addressed. COVAX needs to give best practice recommendations on bilateral deals, create transparency as to which countries do not follow these guidelines, and create extra benefits for the countries that do. Secondly, the system's phase 1 proportional allocation method falls short and disincentivizes high-income countries from participating due to herd immunity being unachievable. We recommend COVAX adopts an alternative framework, the fair priority model, which uses established and transparent metrics to prioritize distribution. Finally, COVAX must work to address global disparity in vaccine deployment infrastructure.
Our third recommendation is to enable equitable access of vaccines across all population groups, particularly those who are more vulnerable to the impacts of the pandemic. We aim to achieve this through multi-component and dialogue-based interventions. At a policy, community, or institutional level, these interventions should directly address barriers to healthcare access, develop localized vaccination and community outreach programs, and address language and cultural barriers through culturally appropriate communication.
A key barrier at an organisational level is the limited delivery of a vaccination programme by providers. To target this, clinical organisations can implement standing orders, reminder recall programmes, point of care prompts, and provider reminders, and deploy clinician education surrounding health literacy. Dialogue-based approaches such as shared decision-making with patient decision aids, motivational interviewing, and positive framing are effective methods of increasing immunisation rates. At an interpersonal level, we can see a lack of equitable access due to physical, psychological, and financial restrictions. Institutional and workplace interventions can enable equitable access via the formation of an institutional norm. The provision of convenient and no upfront cost on-site clinics can increase the uptake among those who are less likely to attend primary care due to these restrictions.
The 3Cs model of vaccine hesitancy, incorporating the pillars of confidence, convenience, and complacency, is used as a foundational aid in developing multifaceted strategies to address hesitancy within the population. Building trust within countries can be achieved by adopting the OECD trust framework, incorporating these pillars listed below, and inviting public engagement. Having a diverse profile of population-targeted communication ensures the widest outreach of information and maximizes understanding of vaccination goals between groups subject to their level of health literacy. Additionally, behavioral science approaches can be used to incentivize individuals to increase vaccination uptake as an element of public responsibility. Risk communication and community engagement programs can also be set up to continually support a two-way system between healthcare professionals and the public.
So when it comes to monitoring the vaccine action plan performance, we would like to apply 3 methods to evaluate the overall effectiveness of the vaccine action plan. Firstly, vaccine preventable disease surveillance should be used in order to increase the comprehensiveness of the disease surveillance. It aims to optimize the immunization program and evaluate the potential risks and effectiveness of the vaccine. Moreover, having a robust pharmacovigilance system is recommended to record and effectively report adverse events following immunizations. Finally, household surveys can provide reliable coverage estimate based on the representative sampling and offer more possibility for covering evaluation. In summary, the above 5 evidence-based recommendations can be used to address the ultimate goal of ensuring good health and well-being globally by increasing the uptake of immunizations. So thanks for watching.